Okay. So I'm going to do my postpartum assessment. So I'm going to knock, identify myself, provide for privacy, check the mom's band or identification, make sure it matches, have her tell me it matches everything, so we're good. I'm going to ask her if she needs to pee. If she's peed recently, she has. If she hadn't, we'd want to have her pee. Go ahead and urinate, as this can cause more pain during the assessment, and it can make us not be able to feel her uterus as well because it takes up space. So I'm going to want to glove up now. I'm going to ask her how her pain is. She says it's good, as to be expected. So if we would want to assess her pain like on a 0 to 10 scale. She said hers is 6. We may want to go ahead and administer some pain medicine if we have an order for it. So we are going to check her breast first. We're going to check and see if she has a nursing bra on. She does. We're going to see if her breasts are engorged, cracked, or bleeding. They are not. We're going to ask if she's breastfeeding. She says she is. If she wasn't, then we would want to educate her on ways to not stimulate breast milk production. So next we're going to expose her. We have provided for privacy, so everything is good there. And the first thing we're going to do is we want to listen before we palpate. So we're going to listen to her bowels, her bowel sounds. Listen in each quadrant until we hear bowel sounds up to 5 minutes. If we didn't hear bowel sounds in 5 minutes, we'd want to notify the physician immediately. Okay, so now that we've done that, we want to go ahead and assess her uterus. So we're going to stabilize at the bottom. We want to do this so it doesn't invert and cause hemorrhage or unnecessary pain to the mom. And then we're going to feel for the fundus or the apex, the top of the uterus. We're going to feel for that. It should be right at the umbilicus, 1 fingertip above or 1 fingertip below. We felt of it. It feels firm, like a fist, in a firm fist. If it wasn't, we would want to massage the uterus in a circular motion. We don't want to boggy uterus because it could lead to hemorrhage because it's not constricting those blood vessels. So next, we want to ask her if she's had a bowel movement, has she urinated, has she been passing gas. She says yes to all of these, so that's assessing her bowel and her bladder. Next, we want to go ahead and roll her over. And what we're looking for here is hemorrhoids. We're going to look at her episiotomy, make sure that looks normal, looks good. We're going to go ahead and take off her pad front to back. We're going to check the lochia. It's scant to moderate, which is normal for someone who's just given birth. So we're going to throw that away, do pericare front to back. We're going to apply the new pad front to back. So next we'll go ahead and take off our gloves. Put new gloves on. And we want to ask if she's had any nausea, vomiting while we're doing this. How's her emotions been? We know a new mom can have emotions that go everywhere, especially some moms have postpartum depression. We want to go ahead and roll her over. We want to ask how she's bonding with her baby, how breastfeeding is going. If she is, she said everything is good. So now we want to check her lower extremities. So what we're looking for here is signs of a blood clot, DVT. So we are checking for warmth, redness, irritation. We want to look at both legs and see if maybe one leg looks like that and one doesn't. That would be especially cause for concern, and we would want to notify the physician immediately. Next, we want to go ahead and look for edema. So we're going to look in her legs, her feet, her arms, her hands, and we're going to check her face. So everything looks good there. We're going to go ahead and cover her back up. We're going to give her her call light. We are going to go over our steps and make sure we checked everything. So we have the acronym Bubble Heap. That is breast, uterus, bowel, bladder, lochia, episiotomy, hemorrhoids, lower extremities, emotions, vomiting, and pain. We checked all of those in our assessment, so we are good to go ahead and go. We'll make sure she's covered up. She'll has her call light, ask if she needs anything. She says no. Tell her we'll be back in 30 minutes to an hour to check on her, and we will go ahead and go out and document.